Right now, millions of older adults are taking medications that may be quietly placing enormous strain on their hearts. What makes this especially alarming is that these are not illegal substances or experimental treatments. These are everyday prescription drugs, medications trusted by patients and prescribed by doctors around the world. Inside hospitals, cardiac surgeons and cardiologists are beginning to notice patterns that are impossible to ignore. In operating rooms and cardiac units, they are seeing hearts that appear far more damaged than expected for a patient's age. Heart muscle weakness, abnormal rhythms, inflammatory markers that remain chronically elevated. When these specialists look deeper into patients' medical histories, one thing keeps repeating itself: certain medications show up again and again. Medical research is now confirming what many heart specialists have suspected for years. Large-scale studies from respected institutions show that some commonly prescribed medications can cause real, measurable harm to the cardiovascular system in older adults. This isn't about rare side effects. These risks affect a meaningful percentage of users. Some medications dramatically increase the likelihood of heart rhythm disturbances. Others raise the risk of sudden cardiac events. And most patients taking them have no idea their heart may be paying the price. Today, we're focusing on 3 categories of medication that heart specialists are especially concerned about. One of them, in particular, is now being described by some surgeons as a silent but extremely dangerous threat to the aging heart. Let's break them down, starting with a medication many people take simply to get a good night's sleep. Before we begin, tell us your age and where you're watching from in the comments. We read and respond to every single one. Medication number 3, certain sleep medications. Sleep problems are extremely common in older adults. Nearly half of people over the age of 65 report difficulty falling or staying asleep. When exhaustion sets in, reaching for a prescription sleep aid can feel like the only option. But research shows that some sleep medications may come with serious cardiovascular consequences. Drugs commonly referred to as Z-drugs, such as zolpidem and esopaquolone, often known by brand names like Ambien, Sonata, and Lunesta, are widely prescribed for insomnia. While they may help induce sleep, studies suggest they can significantly increase health risks. A large study published in BMJ Open followed more than 30,000 patients using prescription sleep aids. The results were concerning. Users had a more than 4-fold increase in overall mortality compared to non-users. Cardiovascular events were among the leading causes of death. Researchers believe several mechanisms may be involved. These medications suppress the body's natural breathing drive, which can worsen sleep apnea, a major contributor to heart disease, high blood pressure, and stroke. When sleep apnea worsens, the heart is repeatedly deprived of oxygen night after night. These drugs are also strongly linked to falls and injuries. For older adults with underlying heart disease, the stress of a fall, surgery, or hospitalization can trigger heart attacks and dangerous rhythm disturbances. Benzodiazepines such as diazepam and lorazepam raise similar concerns. Research published in the journal Sleep has linked their use in older adults to increased cardiovascular mortality. Daytime sedation, confusion, and balance problems further increase risk. Safer long-term approaches to insomnia do exist. Cognitive behavioral therapy for insomnia, or CBTI, consistently outperforms sleeping pills in clinical trials. Improving sleep routines, limiting screen exposure at night, maintaining a consistent bedtime, and using low-dose melatonin when needed are generally far safer options for the heart. Medication number 2, certain antipsychotic medications. Antipsychotic medications are increasingly prescribed to older adults, often for agitation, behavioral symptoms of dementia, or psychiatric conditions. Over the last 2 decades, their use in elderly populations has grown substantially. Unfortunately, heart specialists are now seeing the consequences. A landmark study published in the New England Journal of Medicine examined more than 44,000 elderly patients taking antipsychotic drugs. The findings were deeply troubling. Patients using these medications had nearly double the risk of death compared to non-users, with sudden cardiac causes responsible for many of those deaths. Both older typical antipsychotics, such as haloperidol, and newer atypical medications, including risperidone, olanzapine, and quetiapine, were associated with elevated risk. These drugs affect the heart in several dangerous ways. They can prolong the QT interval, a change in heart rhythm that can trigger fatal arrhythmias. They also promote weight gain, raise blood sugar, and worsen cholesterol levels, factors that significantly increase cardiovascular disease risk. Some antipsychotics interfere with blood pressure regulation, causing sudden drops when standing. This condition, known as orthostatic hypotension, can lead to fainting, falls, and sudden cardiac events. Because of these dangers, the FDA has issued black box warnings stating that antipsychotics increase the risk of death in elderly patients with dementia-related psychosis. Despite this, off-label use remains common in nursing homes and long-term care settings. In many cases, non-drug approaches can be highly effective. Treating underlying pain, infections, medication side effects, or environmental stressors often reduces agitation without antipsychotics. When medication is unavoidable, using the lowest dose for the shortest possible duration is critical. Medication number 1. Prescription opioid pain medications. According to many cardiologists and cardiac surgeons, opioid pain medications represent the greatest pharmaceutical threat to the hearts of older adults. This category includes drugs such as oxycodone, hydrocodone, morphine, fentanyl, and tramadol. While these medications are powerful tools for severe pain, their long-term impact on the cardiovascular system is now impossible to ignore. A massive study published in the Journal of the American Heart Association analyzed data from more than 575,000 adults over the age of 65. The findings were staggering. Long-term opioid use was associated with a 65% increase in cardiovascular death. Another study published in JAMA Internal Medicine found that starting opioids more than doubled the risk of cardiovascular events within just the first 30 days. Opioids suppress breathing and lower oxygen levels in the blood. During sleep, when their effects are strongest, oxygen levels can fall dangerously low, placing severe stress on the heart. Over time, this leads to inflammation, oxidative damage, and injury to blood vessels and heart muscle. Chronic opioid use has also been linked to structural changes in the heart similar to those seen in heart failure. These drugs disrupt the autonomic nervous system, impairing the heart's ability to adapt to stress. Reduced heart rate variability, commonly seen in opioid users, is a strong predictor of sudden cardiac death. The risks become even greater when opioids are combined with other medications commonly used by older adults. Mixing opioids with benzodiazepines greatly increases the risk of respiratory suppression. Combining them with heart rhythm or blood pressure medications can lead to dangerous interactions. Modern pain management is evolving. Multimodal approaches that include physical therapy, targeted injections, nerve blocks, and cognitive pain management strategies are proving effective. Many older adults are able to safely taper opioids under medical supervision, and often report improved pain control as opioid-induced hyperalgesia resolves. Final thought. The doctors raising these concerns are not telling patients to stop medications abruptly. What they are urging is awareness and honest conversations with healthcare providers. Many medications that once seemed safe are now understood to carry real cardiovascular risks. Heart damage from these drugs is often preventable, but prevention begins with knowledge. After watching this, are you planning to talk to your doctor about any medications you're currently taking? Or do concerns about that conversation hold you back? Share your thoughts and experiences in the comments below. Thanks for watching.